Africa Science Dialogue, closing the gap between science.
Now, One Health. This is a topic that we're increasingly appreciating, the interconnectedness between human, animal, and environmental health. Over time, as populations increase, there'll be a lot of things that we need to deal with in our countries. And one of the things that we should prioritize is One Health. Unfortunately, this has not been the situation for many years. There's been a lot of fragmentation, but over time, we have seen so many actors in the different segments of the environment, of the ecosystem, coming together and trying to work towards a common goal. In the same light, we've realized that there are so many people who need to come on board who have not known until now, or who we did not know until now, that they are leaded on board. In Uganda, this is a situation that has brought a lot of light into the way things are done in One Health. Today, therefore, with me here, I have two scientists from Uganda who will be telling us more about what One Health is doing and the kinds of people they are incorporating into the whole plan and the whole march towards what we think will be a utopic or near utopic future. With me today, I have Professor Clovis Kankia, who is an associate professor heading the Department of Biosecurity, Ecosystems, and Veterinary Public Health, College of Veterinary Medicine, Animal Resources, and Biosecurity, at Makerere University in Kampala, Uganda. There's a lot of experience and expertise in teaching, research, and community engagement activities. He has a formal training in veterinary medicine, field and social epidemiology, rural planning and project planning and development. And he has been a strong force in the establishment of One Health, multidisciplinary partnerships and networks nationally, regionally, and internationally. He's led and supervised several multi-country capacity development funded projects. Prof can also speak Swahili. Prof, habari yako?
Habari za Naivasha.
Prof is in Kenya. He speaks Swahili and many other languages, including the language of One Health. With me also, I have Mafeta Rimwa, who is a graduate research and teaching assistant at Makerere University College of Veterinary Medicine, Animal Resource, and Biosecurity. She works with the National One Health Platform, Uganda, in the coordination office. Her areas of research interests are mainly infectious diseases management, particularly zoonotic diseases, with a specific interest in biosafety and biosecurity management. And she also speaks many languages, the loudest being One Health. I don't know how good she is Swahili as well. So, thank you very much for making time to be with us here. And like I said initially, this discussion of One Health seems to be taking a new turn as we identify more players who should be very active in this. And Prof, we had this webinar sometime not so long ago where we're looking at the silent players. And as it emerged, or as you sounded, it seems that the roles of these silent players can be, even more magnified, and they have very important roles to play. Briefly tell us exactly who are these silent players in One Health? Why are they silent players, and how can they actually play bigger roles in this goal?
Right. Thank you very much for this opportunity for joining Africa Science Dialogue and make this contribution for the country. As you have hinted, I'm happy to mention that in the year 2023, in July, at Makerere University, we're able to have a net mapping exercise. Net mapping is a tool that is participatory, that involves having a number of stakeholders that can be provided with a platform to discuss areas of commonality. And in this case, we invited over 20 stakeholders from the National One Health Platform, the Ministry of Local Government, Ministry of Education and Sports, the Prime Minister's Office, the President's Office, name it. The list is endless. And academia, of course. And our intention was or is to discuss with our stakeholders to understand the landscape of One Health. I'm happy you hinted it right at the start that this One Health is a huge elephant, but in simple terms, it's an approach that is integrated, that is unifying, that is sustainable, where a number of stakeholders, a number of sectors, a number of disciplines, in other words, it's transdisciplinary or cross-disciplinary, come together to address a common challenge. And our challenges in the context of Uganda, complex diseases, like zoonotic diseases, or those are diseases that cross over from animals to humans. And the animals, we are talking about domestic and wildlife. We have challenges of climate change. You have seen in the past few months, we have had a lot of sunshine that has affected farmers directly and indirectly. We have aspects of food safety and feed security issues. We have aspects of biosafety and biosecurity. So all those largely affect our populations, not only in Uganda, but in the region. Therefore, inviting these stakeholders from the different disciplines, from the different sectors, gave us an opportunity to understand their feeling, their influence, their priorities. And this is what we called a net mapping exercise. So while here, it emerged through their discussions that ministries of education and sports that houses higher education institutions, that houses primary and secondary institutions, was clear that was not involved within the National One Health Platform, despite its importance in guiding research and development. Ministry of Local Government was largely invisible in this, despite its importance in decentralizing One Health. And in this case, it would be a challenge if we are talking about decentralizing One Health, whereby we want to go back to the sub-county or district level without involving a ministry responsible for such kind of important contribution. Ministries of, for example, the Prime Minister's office, as the lead of government business, was not directly involved, despite its importance in guiding all the ministries' processes. We also had a challenge. It also came out that the Ministry of Finance, Planning and Economic Development was not directly involved. And this is an important ministry in terms of budgetary and policy direction. So if we are to have One Health effectively implemented, it's important to have those kind of important and key players on board timely. And I'm happy to mention that the National One Health Platform is already revising the One Health Strategic Plan, which will run from 2025 for the next 5 years to 2030. So this will give an opportunity, and I'm happy that these kind of discussions are in time to make sure that some of these important influencers that are not visible, that are silent, are incorporated, not only in terms of meetings, but also right from the planning, so that we plan together, move together, improve from the lessons learned from the previous One Health strategic plan that is just expired. So I think this is my take with regard to the direction where we want to go in terms of One Health ecosystem.
Just before I go to Mother, now for those silent players, given like you personally convinced you convinced they should be more involved and they should come up strongly and support this cause, this approach. But what is their response? Do you feel like, have you engaged them to a certain point where you can feel whether they're positive or healthy? How do they support this?
Yes, I totally agree. They should be involved. However, we need to do much more of awareness and involvement early enough, so that by the time we talk about family, for example, in the second, the review, they should have tasks, should have responsibilities that they play well outlined, so that they don't just come to attend, but they largely participate. They allocate, they allocate funds from their own votes, because in the context of Uganda, there is no vote allocated to One Health per se. They just give sectors, they give ministries, departments, and agencies funding to cater for a bulk of activities. So One Health doesn't surface in reality. And this I submit from the academia side, just to emphasize, we don't have, graduates or people or professionals who are tailored to address One Health per se, in terms of curriculum that we build from the universities, in terms of tailoring One Health, for example, at high school. But we talk about other things, skilling, now the new curricula at secondary level, at A level, things are changing, but One Health is not anywhere on surface. Yes, that's right.
Come back to that.
All right. All right.
Let me go to matter. I see these substantial studies they've done on the proliferation of rabies in various parts of the country, and because it's very specific that the most affected people are those rural communities, and also as there's a lot of mention as people living close to wildlife and stuff like that. Briefly take us through why this zoonotic disease prevalence is an important thing in One Health, and also is it only specific to rural areas? Why should I become the family link part?
Okay, thank you so much. I'm really excited to be part of the African Science Dialogue. So particularly to respond to that, essentially the growing population, specifically even beyond Uganda, has resulted into, human encroachment into wildlife habitation. And of course, this has resulted into, of course, consequences like the spillover of particular infectious zoonotic diseases into these communities. So when we talk about One Health, particularly something that has motivated Uganda in particular to embrace One Health has been the fact that most of these emerging infectious diseases are zoonotic in nature and done at a celoid level to say maybe it is only agriculture or the human side to respond, given that most of these are cross-cutting issues or public health emergencies. So particularly to hint on exactly your question in particular about rabies, I've done quite research in rabies, and particularly looking at the human, domestic animal, wild animal interface. Because of the growing population, there has been a growing, an increased interaction of humans at the wildlife interface. Of course, this has predisposed the human population to quite a number of risks or spillover of quite a number of infections or diseases that were initially in animals alone. So, and particularly when we talk about One Health, inclusivity is one important aspect or principle. So we are not only looking at, we want to look at marginalized communities, the rural setting or communities that are at these interfaces. And particularly these are the communities that are engaged in particular activities or risk factors that are predisposing them to these infections, particularly grazing in the national wildlife reservoirs, or even actively engaging or even consuming bushmeat and whatsoever. So particularly we realize that the risk of infection was really greatly, especially in these marginalized communities. But then you asked that, is it really specifically the rural communities? Of course, we also have the urban settings as well, and they are not exception to these zoonotic diseases. Of course, we know particular rabies. Mainly rabies that we are responding to is we're looking at the dog-transmitted rabies. And of course, we know even in the urban settings, especially those that are in slum areas, really suffering rabies as well, given the growing population of the stray dogs that are particularly, of course, crossing over from the wild or even interacting from the rural communities and crossing over to the urban settings. And of course, this is all hinged on the growing population of Uganda. So this has really resulted or really this has really motivated the need of multisectoral or multidisciplinary response when it comes to issues of this kind. So there's been a lot of what has enabled our response has been increase in data sharing or information sharing, where we have the animal sector sharing their surveillance data of rabies. We have the human sector also sharing the rabies. So this has really enabled our response to be more smooth. But of course, particularly looking at those marginalized communities in point. Yes.
Okay, I'll stick with you first. Yeah, you spoke about how you're interacting and sharing data to different departments, and of course, I agree, you can't do this in isolation. But now the question I will have it, you have the data, you have the research, you like what you say, people grazing in encroaching wildlife and probably vice versa. I think some of the solutions to this are require more people like the government to come in and try. Beyond now the research, have you managed to have the government take the required, steps to combat some of these things that probably lead to these infectious zoonotic diseases spreading? Or is that research, does it end there? How have you managed to integrate players who can actually now implement what you recommend or the research?
Of course, in particular, rabies, it being our national commitment to ensure that Uganda has gotten rid of rabies by 2030, it is also now the mandate of the government. And of course, we know research is now informing policy, informing strategies, and given our stepwise approach towards rabies elimination by 2030, this research particularly came in timely, given that we are now at about step 3, where we are looking at affected communities. So particularly it is informing where strategies should be. Vaccination, most of these rural communities do not access services, health services. So whenever there is a dog bite, the most what they can do maybe is first aid or wound washing, but they don't have the capacity or they don't have these services close to them. So particularly we're looking at uncovering the issues in these rural communities and of course informing government. But our best platform has been the National One Health platform. So whenever we do this research, we share it with the platform. And given that the National One Health platform in Uganda has now embedded it's trying to be institutionalized. So meaning government has a big role to play in it. Government has bought in the One Health. So whenever these issues are tabled, that actually we need to strategize on, we need to target our intervention based on what research is informing. It's really helping us. So our research is fruitful. It is yielding results. Of course, using the channels of One Health, particularly the National One Health platform, that is actually laying this information back to the government for targeted interventions in these communities.
Yeah. Prof.
Just to add, the platform we are talking about here, my colleague is mentioning, comprises of only 4 ministries. So just to clear the air that it's made up of Ministry of Health, it's made up of Ministry of Agriculture, Animal Industry and Fisheries, it's made up of the Ministry of Water and Environment, and it's also made up of the Uganda Wildlife Authority, which is an authority under the Ministry of Tourism, Trade and Antiquities. Yes, so we need to understand that only these 4 entities are the ones that comprise of the National One Health platform. And within the platform, they have their own leadership where there is rotational kind of, coordination office leadership. So I think it's a 1 year, it's annual kind of leadership where the lead of that platform comes from Ministry of Health, then the following year, Ministry of Agriculture, like that, Ministry of Water and Environment, all year round. So in the strategic plan review, they are trying to see whether to extend the period, but also have a committed committee, because those who coordinate these One Health issues are part and parcel of those ministries. But there's no dedication or structured center or office that is employing One Health per se. And this comes because there's no slot, there's no vote allocated to fund employees, for example, of the National One Health platform. So you can see the kind of, challenge again at the platform that is affecting the entire system of management. But it would have been good. And we are trying to see a review comes through so that these are issues that are streamlined and they could support now the leadership and coordination of the platform and One Health issues in the country.
Yeah, and could I supplement to what Prof. Kancha has mentioned? I think particularly if but these particular partners or stakeholders, the silent stakeholders that are of importance to One Health, are brought on board, I think it could really enhance the implementation of the One Health approach. So particularly as looking at academia, like he mentioned, research really has now been the guest of policy making or informing policy and decisions. And I would really want to appreciate the National One Health platform, given even amidst the challenges and structure that's in place, or an office in place, there are particular achievements that the milestones that they have achieved so far. I'd want to applaud, in line with research. Last year, we took part in the process of prioritizing zoonotic diseases of importance, and different stakeholders came in place or came into the room and listed down what are the different priority zoonotic diseases per sector, and they were rated. They went through a whole approach and methodology to come up with these, and actually rabies made it on board simply because it is the research that informed. So they would look at research that has been done utilizing the One Health approach. What were the cross-cutting zoonotic diseases, or what are those zoonotic diseases of national importance? And they were prioritized, and there are 7 zoonotic diseases of priority for Uganda that were mapped out by the National One Health platform. And I think, of course, particularly if sectors like academia, Ministry of Education were brought in place, we would now have a defined research agenda. And then we know that as Uganda, we're working towards this, given this kind of backup. So sure, it is important to bring these silent stakeholders in play, even as we achieve the different milestones. Yeah, sure.
Prof speaks very passionately, and you both have spoken a lot about academia and the Ministry of Education response. But I realized that was spoken a lot during the webinar and here as well. And also, beyond capacity building, which you'll also speak about in the tertiary level, how do we ensure that the Ministry of Education participates more in this? Particularly because you are very specific while introducing it. You talked about they are key in training of future professionals from the earlier stage. How do we entrench this at the earlier stage? So we have One Health, a stronger One Health, like, a cabal of professionals in the future. It's easier to get them integrated into from the lowest levels. Is it possible?
Right. I think it's a roadmap to transformation. I should say that if Ministry of Education and Sports is directly involved, and it will cause a lot of changes. And I think there is a review that is going on at that level, where I'm directly not involved. But I should say that at project level, we have noticed under the Capacitating One Health in the Eastern and Southern Africa project that I lead in the country, called COHESA, we have realized, and we have gone further to partner with the other silent influencer I didn't mention. That's the civil society organization. This civil society organization, in point as a model, is called the Young and Older Persons Integrated Development Program in Africa, ULIDA, that is based in Bunyangab district in Uganda. We have worked very closely in collaboration with ULIDA to ensure that we go to these primary schools, because One Health is not anywhere structured, but they have integrated science. We have also worked with these pupils because we stem from a situation where we are aware that children form and youth, of course, form the biggest population in the Ugandan context or in the sub-Saharan Africa to kind of enlarge the full picture. So we could tap into this instead of using children or working with children with this organization from the disadvantaged perspective. We work with them to build and transform the future through One Health. Now, how do we do it? We work with this agency under this project called COHESA through drawing, appreciating the art for conservation and heritage, because this non-government organization was already doing this. So we said, no, with COHESA, let's come and support you to see how children, pupils in primary schools and secondary schools can appreciate drawings where animals, environment, and humans interact. So they draw. That's one. The second approach, we encourage and appreciate children when they have school gardens established. These school gardens are a form of cabbages and sukuma wiki, for example, in Kenyan context, but Uganda will plant cabbages, will plant vegetables. These help these children support the nutrition arm in schools. And that's very, very important. Thirdly, we have also established in these model schools, we have established what we call small animal projects. Small animals like rabbits, small animals like chicken, goats. These waste products, wastes from these animals are utilized in the gardens in those schools. So that children at that stage as pupils, while in their schools, are able to appreciate nature, appreciate One Health, and they call it One Health, One World ecosystem. Now, this is just an example that we are doing with primary schools. And we do this in the lunch hour. So you can imagine the kind of commitment and sacrifice these kind of model schools that we are picking on. So the children are called One Health ambassadors. And the teachers who voluntarily appreciate to work with us are called One Health mentors. Therefore, this kind of start cannot be underrated. Now, coming back to your question, Ministry of Education and Sports could look at this as a start point and maybe try to extrapolate this from one district to the other. And as a project, we are willing to give this kind of innovation shared countrywide. I submit.
Well, that's a good approach, because I think one of the problems we have in having, and we have discussed this a lot of the Africa Source Dialogue, is good that our children do not feel like it's interesting to join sciences at a time when the arts look like it's what's giving people money in the future, and as they're looking at flashy lives and everything. By the time they realize they can go into STEM, it's a little too late. Tim, go back to that discussion, back to Moira. Recently, there was an Ebola outbreak in the country. And that was dared by the Ugandan Ministry of Health on 30th January 2025, lifted on 26 April 2025.
Yes,
One Health was definitely involved in this.
absolutely.
How was it in this quick cancellation?
Yes, I could term the recent response as One Health in action. Yeah, it was really an exemplary response. Just like you've seen, the response duration was quite brief. So the ability of the country to halt the outbreak before it could spill over to other regions was as a result of really exemplary multidisciplinary collaboration. One Health was really at action because even on part of the response teams or the different pillars that composed of the response towards the EVD outbreak, composed of, animal health scientists, human health, environmentalists, entomologists, anthropologists, the social workers were on board. So everyone was really on board, the risk communicators. So it was really a definition of multidisciplinary approach towards the response. And on top of that, there's been now an effort in supplement to the response to look at the ecology, to study the ecology or the ecosystem where the response, where the outbreak sprouted, and understand what could have been the source of the outbreak. And still we are seeing different cadres of multidisciplinary cadres, the scientists, the entomologists, the bat ecologists coming on board and working together, sharing data to ensure that actually we also find out and know what could have been the source of the outbreak. So really what enabled the outbreak, the response to be really short and brief and precise and accurate was as a result of One Health. There was a lot of data sharing and exchange. There's a lot of capacity building. So it was really hinged on the principles of One Health. Yes, sure.
Okay. Now, for scientists, I know this is a thing, basically because society perceives science to be a very complex thing. Either way, I think it's a thing. But there's a lot of misinformation that tries around and prohibits or like derails the rate at which scientists achieve whatever they want to achieve, the implementation of their research or stuff like that. Have you encountered, I started here, Prof, misinformation and disinformation at a level that you probably feel like there is a whole barrier towards preventing you from achieving results of your research at the university?
The point you are bringing out is very, very pertinent. and its core, and it was one of the things that was highlighted in the meeting we had in 2023 July with this net mapping exercise. And of the other important pillar of people that science doesn't normally involve, but of late they're trying to involve them, is media. So involvement of media can correct the problem you have just shared. Well, how? For example, in COHES, I'll go back to a project I've coordinated now for the last 4 or 5 years. We have involved media in form of media cafes. And this, in a way, once you involve media, you correct, you clarify, you streamline, you guide the clarity in terms of information that you'd like the public to absorb. And it's important because there are things that media may not understand. But it's important when you come together, educate the media, what is correct about a particular attribute is made clear. But also secondly, scientists tend to use jargons. They tend to use complicated science, complicated terms. Now, through working with media, I have learned, or we have learned as Macquarie and as a team from the projects that I have been involved in, to make sure that we make science as simple as possible. And this will try to erase the misinformation and such kind of uncoordinated communication. And this is core. So identifying those stakeholders early enough at the beginning of the project is key, and involve them, educate them, create awareness so that you move together as a team. So media are two key influential, people or key influential stakeholders who should be on board right from the start. So among the people that we invited in this July 2023 meeting were the media people, and we held a webinar, we call it what? Science Cafe, where we clear the air on what we do, on what we don't do, where the project starts and where it ends. And this is very, very important so that you're clear with your scope in terms of coverage, you're clear with your time, when the project will start, when the project will end, or where you are, and you're also clear in terms of costs. Because oftentimes media can report that these billions of the project are injected in that project, when actually it's not true. And if people are asking you, you have billions of money, so it's important to be clear in terms of cost, in terms of time, in terms of scope of the project, and that will ensure quality delivery of a project. Yeah, so stakeholder identification and media being the other top on the list is very pertinent for us.
On the same topic, when you talk about One Health, you are touching on issues that are literally life and death. Because like when you speak about rabies, they talk about possibility of
Yes.
is life and death issue. Sure. And there's nobody who can speak to this as well as the scientist who understands the origin and the possible solution. I said, giving scientists themselves are doing enough to communicate with people.
Thank you so much. Now, in line with that, actually getting more tricky because when we look at cross-cutting issues, I mean, a case in point, rabies affects the humans, it affects the animals, livestock, all sectors are affected. So in an instance that we have an outbreak ongoing, who is supposed to communicate? All sectors are affected. And then in line with the scientists as well. So I think I would really, I'm in line with what Professor is saying, that actually bringing the media on board is actually one core thing that we should look at. But then also, yes, the scientists know the knowledge, they know the risk factors, they know the epidemiology of the disease, but will the community understand? So now as One Health, we are switching from the mere technical complexity and looking at community-based approaches, whereby we are bringing and capacitating village health teams, community health workers, that they can be in the best position to pass this information because they understand the communities and they are willing to learn. So we are looking much more into training, capacity building, right from that. So as in line with actually even One Health, we are looking at decentralization. Can we capacitate and train District One Health teams, sub-county, yes, One Health teams, parish or village teams. So that when particular technical communication needs to happen or maybe research findings, these are the people at the front line because the community understands them better. So the risk of miscommunication will really be solved, I think, once we keep in that line. Yes.
Just to add, when we talk about science, people normally think about, for example, the example of rabies she used. People think about a veterinarian is very, very key, and perhaps a medical officer or health officer in this case. But there are some other professionals, and that's why we are talking about transdisciplinary or cross-disciplinary. For example, social scientists, for example, engineers, for example, people from IT or IT professionals. All these need to be on board. Why? Because they perhaps are able to develop applications that could help in a particular preventive or control intervention. A social scientist will have capacity, after having fully understood the problem, to handle, talk to people, talk to the community, create awareness, cause behavior change thereafter as a significant outcome. And you find people now could manage a problem much better than before. So in the perspective of transdisciplinary and cross-disciplinary, covers many other disciplines apart from the mainstream science. And that's why during our meetings, as I shared with you, people were thinking One Health is about health. It's beyond health. Different sectors have a role to play. Different disciplines have a role to play. And this is why we are talking of multi-professional intervention. So in line with the community and decentralizing strategy, a social scientist can be a game changer for a particular communities or community that has been strongly or widely affected by a particular rabies or emerging problem or climate change or whatever it is. So we would like to say that One Health, as she mentioned, should be in action. One Health should be practiced. One Health should be a continuous process and built, empowered, nurtured for the future. The future generation will benefit from One Health, even when we are gone.
Yeah. And I like that you appreciate and you make it you make it clear that there's no one like it should be multidisciplinary and or so many people should come on board for this. Because I feel like what you say about the media, sometimes once they are excluded and they're the loudest people in society, then definitely you are going to be disquoted. And there's something we keep on saying about the person who is delivering a message determines exactly how your message is received. Is why you either work with the journalists so that they deliver the right message, or you deliver through the journalist by yourself going to the media houses and answering questions and responding to whatever people are asking. And now, finally, as we wind up, you spoke about the One Health strategic plan, right? All right. And you said that's running between 2025, 5 to 2030. And end of it, what is that one thing that you feel will have big overhaul or change by that time? Would you really feel the one big thing or the one thing that at your fingertips you can say you expect it to have achieved by 2030, Uganda?
Yes, maybe I could start. One Health strategic plan review this time round has involved a wide range of stakeholders and planning unit of the different ministries, agencies, and departments. I'm optimistic that by the end of 2030, we are going to have a different kind of direction in terms of managing One Health, the level of order, unit of direction, funding, because Ministry of Finance Planning and Economic Development, that was not directly involved, now is involved in this at this planning level. But also, most importantly, contribute to national programs, for example, the National Development Plan 4, because we have a mirror while addressing these reviews, and we have made sure that we have included the National Development Plan 4 requirements or agenda. We have also not only stopped there at national level, we have also shared, and I'm happy to mention that international quadruped agencies have been involved in the review. meaning that this is the cream kind of One Health strategic plan, which we are going to launch shortly within this year. So I see this kind of roadmap to the right direction in terms of what is going to be done in the next 5 years. But then after the review, there are lessons that will be learned. And the next review, maybe 2030 or 2031, it will be much better in terms of addressing aspects. Of course, involving issues of faith-based organizations, issues of private sector, for example, that is deeply involved in manufacturing some of these vaccines involved. So as a country, I see us at a different level come 2030 or so.
You share Professor said.
Oh, absolutely. And maybe just to supplement, this second iteration or the review of the National One Health Strategic Plan is also really going to is now focusing on institutionalizing One Health across and finalizing the policy so that we have the legislature arm of it, that there is enforcement. And just like he mentioned, we are fighting to have a voice or to have a designated basket for One Health. But, we have a vote. And also issues of academia, defining the research agendas, all these have been embedded in this new draft of the National One Health Strategic Plan. So I think we are headed really for a good direction. Yes.
Okay. Now, clearly, One Health is going to be very important in the future. I think Prof has one last thing to say.
Yes, I wanted to say, in line with academia, we have been getting support. Like you introduced me as one of the leaders of a number of multi-country projects. So I've been getting funding, some bit of funding to support graduate training at master's, PhD, and postdoc levels. But this money comes from Norway, comes from, European Union, comes from. We don't have money slotted, for example, from the country basket. So when she mentions about the economy, and for us involving Prime Minister's office, involving the State House, involving Ministry of Finance Planning and Economic Development, it's intentional so that they own the process right from the start, and having a vote particularly slotted for capacity development so that we build human capital tailored to address issues of One Health. The challenges are complex. They cannot be handled by a single entity. So I would like to end with this, that, it's a concerted effort that requires capacity build by building the human capital, but also social capital and other networks to ensure that the direction and the future of One Health in the country is well catered for.
Yeah, thank you. Now, listening to the One Health experts, Philip Bender, you can tell that it's clear that no one person can actually do this job alone. Not the professionals in health, not one person can do this alone. And involving everyone from the highest office in the land to the person who probably has never heard about One Health at this point. Like I said, population is only going to increase. A lot of issues will be happening in the future where governments will have to choose where to put their money, where not to, as they try to handle so many challenges that are emerging, especially in the sub-Saharan Africa. But we have experts to actually have a clear roadmap and clarity of where we need to go. And One Health is not something we can debate whether we don't want to have this approach. It's mandatory. Otherwise, we are losing our planet. Thank you very much, Professor Kunkia and Mother. Thank you for coming on to this Africa Science Dialogue, where we keep discussions on science in Africa relevant. We've been talking about One Health. You have heard it all from the experts themselves. You can see a clear picture of the future. I hope I'll have them so many times between now and 2030. And in 2030, we can look back and see is actually we have gone the far that they have predicted it can go. And that's the far we want to go. And if we can go even further, the better. It's for the health of our planet. It's for the health of humans, the environment, and animals all in all. Thank you very much for joining us on Science Dialogue. Thank you very much. And we'll be teaching you more Swahili in the course of the day, then spreading this message across. Santisa is the Africa Science Dialogue, where science is discussed in depth. See you next time.